She's convicted of killing 7 newborn babies and attempting to kill 7 more. In English tabloids, she's even referred to as Nurse Death. But now a major update in the case of Lucy Letby.
The neonatal unit at Chester should be the safest place on earth for a newborn. But beginning in June 2015, a string of inexplicable tragedies gripped the ward. In just 1 week, 4 infants collapsed. 3 of them died. The hospital normally saw 2 or 3 neonatal deaths a year. This was unheard of. As doctors and nurses scrambled for answers, one dark fact emerged. Lucy Letby, a bright 25-year-old nurse, was on duty every time. In mid-2015, senior staff began an informal review. They classified the early deaths as medical incidents, even though Dr. Brary privately urged deeper scrutiny. Behind closed doors, an investigation took shape. Hospital managers pulled charts and staff rotas. A startling truth surfaced. Wherever these collapses happened, Letby was the common thread. No other nurse had been present at every crisis. Still, by late 2015, the hospital had not yet alerted police. Meanwhile, parents were reeling. Early in the fall of 2015, twin brothers, Child A and Child B, were under Letby's care. The father's careful record of the twins' condition offers a chilling clue. Doctors later testified that air had been injected into Child A's blood, causing an embolism. Child A died. Child B survived, thanks to frantic last-minute care. The heartbreak of twins A and B was the first warning sign. And it would not be the last. In August 2015, another family's world was shattered. On the 3rd of August, their tiny son, Child E, collapsed and died after air was pumped into his bloodstream. His surviving twin, Child F, required round-the-clock vigil to stay alive. Over the next weeks, infant F fell critically ill. An overdose of insulin was later detected in his system. His twin brother was left dead. Parents began whispering a name among themselves, Lucy Letby. By summer 2016, senior consultants had gathered. Dr. Stephen Brary, the lead neonatologist, demanded action.
3 deaths that the staffing analysis did identify that Lucy Letby was on shift for those 3 episodes.
And did that worry you?
Well, I think I can remember saying, oh no, it can't be Lucy, not nice Lucy.
The deaths and near-deaths were far beyond normal variation, and every time Letby was present. In late June 2016, Brary insisted Letby be pulled off the ward pending investigation. Within days, Lucy Letby was removed from clinical duties and shuffled into administrative roles.
Anybody did. It's something that nobody really wants to consider, that a member of staff might be harming the babies under your care.
As Letby left the NICU, the hospital quietly started combing through records. Hundreds of nursing notes, medical charts, and staff schedules were examined line by line. Detectives later described the result as a tapestry of murder. The investigation turned criminal. In July 2018, 3 years after the first tragedy, Cheshire police arrested Lucy Letby. She was held on suspicion of multiple counts of murder and attempted murder. Within a week, authorities announced they would charge her with 7 counts of murder and 15 of attempted murder across 17 babies.
I'm going to put you in the back seat over here.
Hold on, Mom.
Yes. Okay, just take a seat in there for me, Lucy. I'll move that seat forward a bit. Sure.
I've just had knee surgery. So.
Oh, right, okay.
It would be nearly 4 more years before the case went to trial. Meanwhile, detectives expanded their probe to Letby's earlier career, even reviewing her work at other hospitals. The accused nurse proclaimed her innocence, but evidence piled up. October 2022. In Manchester Crown Court, the prosecution set out its case. They described how doctors had logged a significant rise in unexpected neonatal collapses, far beyond anything justifiable by chance. No plausible medical cause could be found, one expert testified. Each time, Letby was there.
Lucy Letby, over a period of almost 13 months between June 2015 and June 2016, when in your mid-20s and employed as a neonatal nurse in the Countess of Chester Hospital in Chester, with specialist training in intensive care, you murdered 7 babies and attempted to murder 6 others. In the case of one of them, trying on separate occasions 2 weeks apart.
The CPS detailed the methods Letby used, grotesque and calculated, injecting air and insulin into infants' veins, force-feeding milk into their tiny lungs, even inflicting blunt trauma. As Pascal Jones of the CPS put it, in Letby's hands, innocuous substances became lethal. In her hands, innocuous substances like air, milk, and insulin would become lethal. She weaponized her craft to inflict harm, grief, and death. Investigators produced a damning array of proof, medical records showing impossible recoveries, staff schedules revealing Letby as the constant factor, her own social media posts made during shifts, and diary entries like, "I am evil, I did this." July 2023. After months of testimony, the judge sent the case to the jury. For the families of the victims, the final weeks of the trial were agony. On August 18, 2023, the silence in court was shattered by the jury's verdict. Lucy Letby was found guilty of 7 counts of murder and 7 of attempted murder, confirming that 7 babies had died and at least 6 others were nearly killed under her watch. The reaction was mixed. A stunned hush fell over observers. The press called her Britain's most notorious nurse killer, a label Letby herself had fiercely denied. For the parents, it brought a haunting kind of relief.
Knowledgeable, confident, and professional nurse, which enabled you repeatedly to harm babies on the unit without arousing suspicion for some time. You prided yourself in your competence. Your fellow neonatal nurses spoke very highly of you, and several of them became your close friends.
On August 21st, the judge imposed sentence. Justice Spencer handed down a whole life order, meaning Letby will spend the rest of her days in prison. As Letby was led away in handcuffs, the gathered media carried her victims' stories to the world. One court artist sketched tearful parents, proclaiming Letby had destroyed our lives. In the months that followed, Chester Hospital faced tough questions. How had so many alarms gone unheeded? In September 2024, a public inquiry led by Lady Justice Thirlwall was launched to get answers. Healthcare leaders promised to learn lessons, a vow meant to honor the tiny lives lost.
They told me that there would be a lot more deaths and that I'd been linked to somebody that was there for a lot of them.
Did you have any concerns that there was a rise in the mortality rate?
Yes.
Okay, so tell me about that. What concerns did you have?
I think we'd all just noticed as a team in general, the nursing staff, that this was a rise compared to previous years. They told me that there would be a lot more deaths and that I'd been linked to somebody that was there for a lot of them.
Did you have any concerns that there was a rise in the mortality rate?
Yes.
Okay, so tell me about that. What concerns did you have?
I think we'd all just noticed as a team in general, the nursing staff, that this was.
The story of Lucy Letby is one of profound betrayal. These crimes were unspeakable, yet they happened behind the facade of a caring profession. For the parents, the pain will endure, as will their memories of the children taken from us far too soon. The hospital and the nation now carry the burden of ensuring nothing like this ever happens again.